in order to alleviate the burden of the patients of their anxiety of not being able to get to their therapy. And this was just for a protest. So you can imagine what their plans are now and how robust they are, especially for this. In terms of all other healthcare facilities, as well as mental health, we are now working on mental health committee, as well as we're trying to really get our robust healthcare coalitions. Healthcare coalitions, we now have 7. And what it is, these are regionalized groups of all facilities, even emergency management, police, fire, EMS, hospitals, dialysis, even funerary personnel, getting together and meeting and creating the networks that they need in order for them to know each other and be able to help each other until government is able to actually provide some support for them. And that's actually the direction that we're going in.
Dr. Cruz, do you want to?
Yes, from the emergency response aspect, I think that there's room for improving, how we prepare these missions. Sometimes we do prescriptive missions, so we know what kind of resources are going to be deployed immediately when requested, to include specialists on those areas. Also, the way we do assessments, we need to include asking questions that are specific about to identify people or how prevalent are those conditions in the impacted communities. We also need to collect better information, fortunately, about the people that die as the result of this, so we can have a better information and more information to justify and to push these resources early on a response.
Okay. I think in terms of kids in schools, what we know in general is that kids do better when their support structures do better. So we can head off a lot of mental health problems, trauma and otherwise at the past if we're able to support the caregivers, including both parents and teachers. And so preparing them ahead of time to understand what kids need and get out the information about how to, what are the protective factors around, again, I said it before, but returning to routine, making sure that that they feel connected, that their exposure to the traumatic events themselves are as minimal as possible. So I think some of the sort of coalition building in communities so that parents feel like they have the support and the resources that they need, and certainly teachers so that they can feel like they have the resources and the support that they need, ultimately protects kids from worse mental health outcomes.
Yeah, I think the long-term health problems is really important because most current research only focus on the immediate effect. So I think we can use the state governments like the assistant database, like SPOT state and New State. Most states in the United States, they have like the ED or hospital admission data available, so we can check the database over time for that. Yeah, another thing is like we do find that comorbidity of those diseases significantly increase, especially those people have like multiple comorbidity, like the 8 to 11 comorbidity significantly after hurricanes. So that's another angle we should pay attention to. Yeah, and the control area we find they also have increased risk, but not as high as the exposure area, because I think that in general population they have general anxiety for those events. So we also should pay attention as a government agency to those areas, just near the affected area, even they don't have direct impact, but they do have a psychological.
I'm not experienced as the speaker, other panelists. Just based on my personal experience, I thought when I was a kid, when the typhoon, we call typhoon, is kind of similar to the hurricanes. They come every year. I was so scared about so when we lived in a house made of wood 100 years ago by my grandfather's grandfather. And I was always scared that the house would fall down. So I think it's kind of maybe mental disorder, right? So I think evacuation might be important. So sometimes we just move to our father's friend's home. And based on this study, we found that like green coverage is an important predictor for the population vulnerability, like for the injury and respiratory things. For the injury, the research the literature said that the tree fall down is one of the major cause of injuries. So I think if people living like whose house is surrounded with old trees, I think maybe it's important for them to evacuate like other places before entering the storms.
Great, thanks. So let's open it up for, please introduce yourself. Yeah, stand up and ask your question.
My name is Ruth Richardson. I am on the faculty at Cornell University. My question is about after Maria. My understanding was a lot of the water systems went offline and people didn't have access. So I was a little surprised there weren't more infectious diseases coming onto your radar. Were people just really good about chlorinating, or is it an underreporting of water or foodborne disease?
Well, remember that Puerto Rico, we're prone to hurricanes every single year. So people have come to being a lot more resilient in terms of water. And something that even Irma helped us with, I don't like to use the term, but something that it helped us with was Irma's coming, so everyone went and got bottled water. And they totally avoided using tap water. And one of the good things that happened was that actually PRASA they were able to coordinate promptly with Puerto Rico Emergency Management and with FEMA to make those stations a priority. Our main problem was power. That's where the problem was with our water systems, was no power, no filtration. And we did have an aggressive educational point of view towards going into communities and showing them how to chlorinate. We had a lot of help from different NGOs who were really great and really forthcoming to go into different communities, especially those that we call non-PRASA, who have wells or have their own water systems. They were very proactive into going into those communities, into trying to avoid any sort of outbreak that we might have with those diseases that are related to water.
Any other comments on that? Yes.
Similar along those lines, but maybe taking it a step further. I was on the island during the hurricane and in the aftermath. I was writing my thesis. I was a master's student. I'm now a PhD student at Tufts University. And so maybe it's because of my bias with food, right? But I'm worried and concerned that one of the things that we focus on isn't nutrition. In fact, there was a study done by someone at GW, a researcher, who looked at the healthfulness of the food that was being taken to Puerto Rico in the aftermath of the hurricane. And one of the things she found was that it couldn't possibly meet even the dietary guidelines for Americans. So when you think about what kind of food the population is receiving, if they are receiving any kind of food aid at all, what is it that they're eating? How does this affect the very large quantity of NCDs that Puerto Ricans live with and that we've been talking about? And thinking about how this is a problem and how that affects vulnerability on a larger scale. So the interruption of the kinds of food, the interruption of the water service, I honestly think, having been there, having gone to Las Marias, having gone to Ayuda, I saw how devastated things were directly. I gave out water filters because I know people were having a hard time finding water. And maybe the people who could and the people who had space could go buy storage, but there were so many people that could not and could not possibly be individually prepared for this. So my concern is, why are we continuing to put an emphasis on personal and individual resilience when there are things that we need to be doing at this level? And one of the things that I really appreciate about this particular panel is that there's lots of people. There were some very academic presentations. There were also some very clear practitioners. But I also think that there's a gap, as the coordinator well pointed out. Researchers are talking about NCDs. Researchers are talking about substance abuse, and especially mental health. I still haven't been able to find someone to deal with my own PTSD. I know how hard it is. And I'm in the Boston area. But with all the things that I have going on, finding a practitioner that works with my health plan, anyway, that's another story. But going to long-term effects that are going on in Puerto Rico right now, I'm lucky. The practitioner exists in my area. But what about what's going on in Puerto Rico? I have family. My home is in Puerto Rico. I was there. I'm still there. I still feel there. So seeing how we are working in silos, how is it that we can bring these together and actually come up with ways to bring in all this knowledge that we have on the importance of focusing on these long-term effects into all these emergency management efforts.
And I'm really glad that you bring up this subject. I think that is one of the big opportunities that we have with the academia, with all of your research and all that you know, in order for you to help us get out there the information that people need during blue skies. Because here's the problem. Many people, even before the storms, they would get money to go to the groceries, and you can go to the grocery store and just look at the parks. Even people buying, are they really buying nutritional food, something that's really good for them? Have you seen the indexes for obesity, especially in Puerto Rico? People have lost that part of the nutrition that we used to have, in which a full meal had different types of food of that nutritional pyramid. People have lost that. And it's a cultural thing. It's something that we've been really struggling with. Something, and I do understand you. I was there. I was able to go to Puerto. Actually, I was one of the volunteers going there at one point to bring food to them, and I saw it. I was there. And it is true. It's absolutely true. Nutritionally, I can tell you from the part of mass care, for example, on a government standpoint of view, food and shelter, it is provided by the Department of Education. They're the ones preparing the meals for the people at the shelters. And even people who are not in shelters but go to the shelter to eat, they are able to do that. And it is actually planned for by nutritionists. There's actually now, it had been before, but now it's getting more up to speed, on a nutritional committee, and they're working on the feeding plan. So if anything like this happens to us again, once again, how can we help our population? Of course, communities like you said, Las Marias and other different communities inside the island, it was very hard for them to come out to be able to purchase different foods, but it was also very tough for us to go there and bring them different foods. We live on an island. We didn't have all the resources that we would have wanted to be able to provide to everyone. Think about 3.7 million people in need. The government was already broke before the island came, before the hurricane came. We had 2 hurricanes back to back, and like I said, where did our resources come from? Florida had been bumped by Jose. So it was a very difficult time, and I'm deeply sorry that you still have your PTSD. I can assure you that we're responders. We were there. We were just talking about that before we came out to the podium. Something just as silly as personal hygiene. I washed my clothes in the river, and I lived in an urban area. Well, close to an urban area. I was in Bayamón, but in the countryside of Bayamón, I had to go to the river to wash my clothes. So at the JFO, we were like, hey, are you good? A lot of splash or something. And that's part of our mental health. We didn't feel right. Even responders, people forget that responders are survivors too. We came from everywhere in the island. We had to leave our families behind in order for us to get to work. Some of our peers couldn't go to work for months. So that meant no income for them. And they had those same issues. No food, no adequate water. They lost their homes, and they still left their families behind in order to help the communities. So definitely need to make our people and our communities more resilient. We need them to prepare. We need them to learn again the basics on nutrition, like our partner said, and I totally agree with her.
My name is Margaret Alexander. I'm a professor at SUNY-New Paltz, and who have been involved with some disaster responsiveness that resiliency, we have to kind of have a different mindset to look at what do they have, what does the community have, and rather than individual, but a village, where pieces can come for everybody to come together and shelter in place together. That individual aspect, I understand, and the young lady who's talking about her PTSD is alive and well in many of us, but it's a very good place to start to think about the mental health issues. If we, as the educators, the knowledge individuals, are experiencing this PTSD when we know what we went through, imagine the people who actively went through it and haven't had an opportunity for their voices to be heard. So moving forward, I think targeting the mental health part, targeting not only the physical, and yes, the physical, we're all in the rebuilding mode. One of the, and Curtis is here by me, in the meeting when the governor's rebuilding program started. Me as a nurse, my instinct was, okay, we need to go down, look at the physical, look at the mental. I think that needs to be pursued.
Yes, I agree with you. About a week ago, I was in a meeting in a military base in Puerto Rico, and we have the health side and we have the military side. And when we started with our health plan presentation, we put a 1 minute or 2 minute video of Hurricane Maria. And when the lights came up, the people had tears on their eyes. And I think that the effects of Hurricane Maria and Irma are still present. There's still people who died, we didn't know what they died from. There's still people who are fearing about their loved ones. There's still people that look at their houses and see the impacts of the hurricane in their houses and their communities. And you bring very important point is the mental health aspect of disasters. And I would like Dr. Sorry, I got you. Nitza to comment on that. Beyond the children and beyond the schools, what are some of these things that we, as the local people, federal and local people working to improve our future responses? Any recommendations for us?
So, thank you for that question. So doing actual RCT type research on the immediate response is challenging for a lot of reasons, ethically and logistically and otherwise, but there are
RCT controlled trials, doing a controlled trial,
here's what we know, 5 things. From the best summary of the literature, here's what people need. They need to feel safe. They need a sense of calm. They need a sense of self-efficacy and community efficacy. They need social connection and support to feel that. And they need a sense of hope. So if all our interventions can sort of be geared toward promoting those 5 principles, then we're on the right track. And of those, one of the best empirical support is the social connectedness explanation.
So I think the challenge is how do you get that set up in every community that might be affected in the future, and get it set up in advance. And it really speaks to the social determinants of health in communities, as well as what resiliency can we build into communities ahead of time. Are there structures that we can try ahead of time? And I don't know that I have the answers, but we're constantly in this sort of reactive mode, and to think about what we could have done beforehand that would have improved the situation. I don't know what the answers are, but I think that's a challenge for us.
And I would like to add, in Puerto Rico as well as here, we have the HQACs, the federally qualified healthcare facilities, or 330s, and many of them, one of their requirements is that they work with the communities, and they do have mental health programs that go straight into their communities. And one good thing that we have in Puerto Rico is that these facilities are actually located inside the island, in the heart of the island, within those mostly impacted communities. And now we've been really working with them and how can they augment their community preparedness, and how can they actually help these people when the time comes and there's more need.
Question?
So, hi, Seth Goodhart's New York City Department of Health, Director of the Office of Emergency Planning and Operations. Full disclosure, I'm on a panel tomorrow with Dr. Lin and Dr. Cruz. This same panel tomorrow afternoon. Just one comment about healthcare provision in the territories, which is no one's mentioned the sort of nasty 5-letter word, which is TEFRA, which sets the reimbursement rates for Medicare, and sets them. If you look at the schedules, they're fairly low when you look at a hospital like Albany Med versus looking at any of the hospitals in the territories, and that also contributes to a huge flight for medical providers from the territories when they can go an hour and a half plane ride to Miami and have a steady income flow. So that's something that probably needs to be addressed, although from a government perspective, it's, especially from a federal perspective, you're not going to sort of say that outright. But we saw that in the Virgin Islands when I was down there on the recovery team. My question though, I guess, is really focused on more of the response and recovery side. One of the challenges that we faced coming in as a team from the emergency management assistant compact team going into the territories was that the territories had to be set up to receive us. And what we found was a challenge in the Virgin Islands where, and this was a local, so I went down as a local asset. One of the challenges was that there was an emergency support function team running the emergency response. And as Dr. Cruz pointed out, there was a recovery support function team running the recovery side. That was confusing to me, and I'm a seasoned emergency manager. That was quite confusing to me when I was working as a local down there. And I guess maybe from the counterpoint perspective, could you just talk about that from the federal side, but then also from the local side of being the sort of one who sets that up and then the one who receives that?
Yes, I think there's some advantages to have the two teams at some point in there because there's one of the biggest issues we always have going to recovery is the lack of information from response and transitioning to recovery. I was only there until November, so I was out there when the recovery team moved in full force. But most of the work that we were doing during response, coming with a bias that you mentioned that there's still always, most of the time there's not enough information to establish a baseline on where you are in recovery. How many hospitals are now fully functional, partially functional, or so on. So it's very important to collect the information during the response phase to do a fair transition to recovery. But recovery is a long term. Most of us who work on the response phase just pack our bags and move on. But I think that at some point there is a need to come together and to evaluate this. Today I hear about concerns about what are the indicators of recovery. And I think it's very important that the recovery don't work that part alone. They need the response people because the response people are going to collect the baseline. And then the recovery people are going to monitor those indicators for progress to a full recovery. And those discussions need to take place at a different level. I'm not a field person, but data is always a gap and a concern.
Well, and actually in Puerto Rico, we did not have the two set apart. We stayed on response mode all the way, at least on the health side, until we had all of our clinics and our hospitals go almost back to normal. Okay, so that's when we turned into recovery. So any mission that would come in for support, we would still keep as a response.
I think because of the time, and there's another session that's going to follow on, we'll end, but people are welcome to come up and talk to the speakers, and let's give them all a round of applause again.
Otherwise, I can just get right over there.
So what I was going to say
They all have other obligations and responsibilities.